Hey everyone, do you feel a little bit confused about what's going on? Well, guess what? I wanted to go ahead and make this video each week to go ahead and provide some frequently asked questions within dental and how it pertains to our state of Nevada. So let's go ahead and jump right into this video and go ahead and answer some of your most frequently asked questions. All right, everybody, what everybody would like to know is when are we going to get back to dentistry as normal, whether you're a dentist or a patient? And the answer is that truly we don't know. The COVID crisis has been something that's been unexpected, and we're truly monitoring the numbers and that sort of thing. So right now we have a tentative date of April 30th. And after that point, the real big question is, and what? Might that date be pushed out? It might. But it's really going to come down to what the numbers and how much we've plateaued or started to come down on the number of COVID cases. This is something we'll continue to monitor. We'll obviously be in excellent communication with you, but we might expect a little bit of changes when we come back. It might be limited number of services. There may not be any hygiene, but this is a question that I get all the time. Another great question is, I see my other doctors open, chiropractic office, etc., etc., etc. And I don't want to just single out the chiropractors out there, but what we are deemed an essential service in dentistry, but essential for dental emergencies. What makes us a little bit different is that we have direct contact, but we also have more of the oral cavity and the aerosols where a lot of this transmission is occurring through saliva and aerosols. So that's what's made things a little bit more challenging within our dental profession. And so that's where you'll see some of these entities staying open, but yet we're shut down for only emergency procedures. So again, if you have a dental emergency, please, please, please reach out to us, because we want to be able to take care of that. We do not want you going to the ER, but at the same time, if you've got just an elective procedure that needs to be done, we can put that off till a little bit of the future. Another amazing question that's been asked is, will it be safe? And the answer is that at this particular point, we're doing everything we can now, and it's not only just within the state, but around the country, to go ahead and build the new safe things that might be required to go ahead and treat now in months to come and into the future. And so some of those examples are early on when we get back, or currently what we're doing, I should say, during emergency procedures is excellent screenings. So screening about your history, where you've been, who you've been in contact with, do you have a fever, etc., etc., etc. Those sort of things on the phone. Then you come into the office, the same sort of pre-screening is done again, taking temperatures to ensure we know what sort of symptoms that you might be expressing or not expressing. Then obviously going ahead and continue on with the procedure. As we move forward, might there be, you've heard this mighty word, probably PPE, so that's personal protective equipment. There might be changes in that, differences in masks, gowns, those sort of things going forward. But I can tell you that we are dedicated to maintaining the highest standard so that we can not only do our part as citizens and practitioners, but for your personal safety, my safety, and also the safety for the staff. And I get this question all the time. What if I'm in pain or I have sensitivity? Well, truly we have to disseminate between the two. If you have a dental emergency, it's going to be something where you think you might end up getting an infection, which would then lead you to the emergency room. That's something we need you to call in immediately and get in and see us. The other one is sensitivity. If you're having sensitivity and you've had that for quite a long time, whether it's been to sensitivity to cold or to hot or various sort of things, the number one thing you want to do right away is limit your whitening products. So whitening toothpaste, whitening gels, any sort of whitening gum, anything that's got whitening Listerine or mouth rinse. If you use anything with whitening, that's going to be usually the biggest proponent of sensitivity. To go ahead and minimize that, we try to eliminate that out of your repertoire to make sure that that's something that might bring down your actual sensitivity and help you to get to our date where we're going to be providing a lot more elective services. So I hope you enjoyed this little series of video talking about frequently asked questions. As mentioned before, if you have a dental emergency, please do not hesitate to call our office. We're here. We want to go ahead and see you. We want to do our part to make sure that you don't go to the ER and don't put yourself at risk. And again, I promise you that we'll be answering frequently asked questions as we continue forward, because this is what you're reaching out and asking to me. So I want to make sure I've got excellent communication with you. Have yourself a great, safe, happy day, and we'll chat with you soon. Take care.